Good afternoon, everyone. Thank you for joining today's webcast presented by LexisNexis Healthcare, the next generation of healthcare fraud, waste, and abuse, where identity data, linking technology, and contributory networks intersect. My name is Mary DeCelia with LexisNexis. I will be today's moderator, and on behalf of LexisNexis, I welcome you to today's program. We would also like to thank NHCAA for their collaboration on this event. Before we begin the presentation, I just want to go over a few housekeeping items. At the bottom of your audience console, there are multiple application widgets you can use. We would like this to be an interactive event, so we encourage you to submit questions using the Q&A widget. We'll try to answer as many as possible at the end of the webcast, but if we run out of time, we will address them later via email. If you have any technical difficulty, please click on the Help widget. It has a question mark icon and covers common technical issues. Today's event is being recorded. A link to the on-demand version of the webcast will be sent via email from LexisNexis following the event. NHCAA has awarded this live webinar one continuing professional education credit towards the AHFI designation. To claim the credit, attendees must complete the NHCAA attestation online prior to March 23rd. A link to the attestation site will be included in the email you receive after the event. I would now like to introduce today's featured speakers. Rick Grape serves as Director of Healthcare Innovation for LexisNexis. In this role, he acts as part futurist, part visionary, and as a strategic leader that directs the overall market, product, vision, and sales strategies as it services healthcare and government nationwide. To his vision, he brings a rich background of research and analysis encompassing industry, cross-market, and product knowledge. Holding a BA from St. John's College and an MPA from Cornell University, he brings a unique perspective fueled by innovation and informed by expertise in government and healthcare policy, public-private partnerships, political theory, philosophy, and classical studies. Rich Marino serves as Director of Strategic Solutions for LexisNexis. In his current role, he provides industry and solution expertise on such topics as improving health outcomes, reducing the cost of care, and enabling consumerism. Over the last 20-plus years, Rich has focused on the use of analytics and predictive modeling on healthcare and non-healthcare data. Rich has leveraged this background in industries such as benefit management, statistical software, fraud, waste, and abuse, and health information technology. In addition to LexisNexis, Rich has worked with such companies as Optum, SAS Institute, and Change Healthcare in roles ranging from industry consultant to sales management. Rich is a graduate of the University of Illinois at Urbana-Champaign. With all that said, I will pass the presentation over to Rick Grape. Rick?
Thank you, Mary. And for all of you that are joining us today, we'd like to thank you for taking the time out of your schedules to participate in this webinar. We're excited to share with you a fresh perspective on the challenges faced by organizations that are combating fraud, waste, and abuse, as well as the tools that your plans and your investigations can use as you take steps to engage in your efforts to mitigate it. So for some housekeeping today, we're going to cover some common steps on the state of the industry, common facts that we know you're all struggling with as you're interacting with providers and members and the administration of your plans. We'll talk through some of the obstacles and challenges and really the different types of technology that's used to combat fraud, waste, and abuse. We'd like to spend some time today also touching on the value of contributory networks, some of the challenges and obstacles that are in place to engage in that sort of collaboration, but then also the benefits that your plan can receive if you're willing to undertake some of those endeavors. Balancing data sharing and information security is key, so we'll touch on some of those key points as it pertains to the concept of collaboration and contributory networks, and we'll leave you with some food for thought moving forward. So with that, I'd like to pass it over to Rich Marino.
Thanks, Rick, and thank you all for joining us. Right now you see a slide that says State of the Industry, and if I was speaking to an audience that wasn't so familiar with the problems around healthcare fraud, this would be a scare slide to inform you of the problem that we all need to collaborate and overcome. However, I'm speaking to an audience today that I know is very familiar with the problem. So instead, what I would call this is the more things change, the more things stay the same. Why do I say that? I started getting involved in the fight against healthcare fraud back in 2003. And in that time, I've seen a lot of changes. I've seen an expansion of the rule set that we all use in retrospective claims analytics to find and determine more suspicious behavior and outliers that we previously weren't able to find. I've seen the adoption of predictive models, which look for new schemes that we weren't able to find with simply just rules, and how we can combine the two of them into a multi-layered approach, which might allow us to go ahead and refine and prioritize which leads we should turn into investigations. And I've seen a big movement towards prepayment, deploying select rule sets up front prior to the claim being paid that could be spit out for some type of manual review or positive no decision. I've also seen changes in policy, and the biggest one that comes up recently is the movement towards alternative contracts. I think there is a certain sense of false optimism that if we put physicians or facilities on a capitated payment and with quality metrics that would allow them to receive certain bonuses, that we solved the problem of fraud, right? We solved the problem of fraud because no longer would this fee-for-service world of claim and claim lines and the billing that was put onto those be important. We weren't paying based on that. So the ability to upcode or unbundle was no longer going to be at the forefront of our minds. But the more things change, the more things stay the same. You see a variety of different schemes and information that has come from the last several years. The problem hasn't gone away. Despite the fact that we have innovations in technology, tools, and changes in policy, a lesson I learned early on is that fraud's like a balloon. You could squeeze one side really tight and make sure all the air goes out of it, but all it did was move to a new spot in the balloon. If we're going to be effective, if we're going to develop a next generation healthcare fraud, waste, abuse solution, we need to find a way to make sure the entire balloon deflates. And the common element amongst all these is, in fact, identities. As we in fraud, waste, and abuse, the fight against fraud and abuse, have to grapple with this, so does the rest of healthcare. We're trying to figure out how we can learn and be more intimate with the people that we do business with, the providers that we contract with, the suppliers that we work with, and the members or patients that are receiving the care. It's critical that we not only know who they are, but what known risks associated with them. Now, in our world, we're talking about possible suspicious criminal type risk. But over on the care management side, they want to know about what known health risk. And then finally, what we really need to know, which is critical to uncovering these schemes, who are these people, are these businesses associated with? Critical to fighting any fraud in any next generation solution is a good understanding of the connections in relationships you were unaware of through simply your claims or enrollment or network management information. Such information, for instance, at the top here is a new enrollee coming in from an account that you won. Are they deceased? Is the identity really belong just to one person? Or have they taken a piece of information, such as the name belongs to this person, but the address and the social security number belong to other people? What providers are participating in your network? Do they still do business at the location you're suddenly receiving a claim from? How much does this provider or vendor costing your plan? A real big indicator that everyone would like to know is this member covered by multiple insurers? These are questions that we need to include and make sure we addressed as we build out the blueprint for our next generation fraud, waste, and abuse solution. And Mary, I'll turn it over to you for the poll question.
Great. That brings us to our first poll question. Thanks, Rich. How does your organization typically evaluate and select fraud, waste, and abuse solutions? You have 4 items to choose from: request for proposal, recommendations from colleagues, information gathered at industry events, or companies highlighted in media or analyst reports. Please make your selection, hit the submit button. I'll give everyone 10-15 seconds. And survey shows the results. Rich and Rick?
Thanks, Mary. So right before the poll, we started to talk about identities and questions that we need to include in building out our framework for the next generation solution. I wanted to alert you to a little thing about a trend going on in regards to identities that you probably were already aware of. If you count up all the public breaches that have occurred over the last 10 years, and I don't want to name names, but we're all familiar with them, from government institutions to health plans to institutions that have nothing to do with healthcare but have personal identity information. If you count all those up, every adult American has had their PII stolen at least 3 times. And that's a staggering amount. I'm going to say it again. Every adult American has had their personal identity information stolen at least 3 times solely from the public breaches that are out there. I tell you this to reinforce the tagline at the top of the slide. The battle against identity theft has already been fought, and unfortunately we lost. Now there's a new battle going on, and that new battle is to go ahead and prevent identity theft from turning into identity fraud. And I'll give you an example before we move along. Just like claim-based analytic fraud that's being perpetrated by fraudsters, they could get rather creative. The same thing holds in identity fraud as well. For instance, once you see a public breach, oftentimes right afterwards the organization will come out and say, anyone impacted by this can sign up for free credit monitoring for 2 years. Professional fraudsters know this, and what they'll do is they'll treat your identity like they will a bottle of wine. They'll cellar it for 3 years. Once that's up, it is perceived within the industry that a particular identity is now clean. There are no longer any problems. We haven't seen anything since the breach occurred. Now, no one is managing that back door, and a fraudster could utilize it for all sorts of illicit behavior. That brings us to today's challenge. All these schemes, all these questions I asked you, they present so many more potential investigations you could pursue. And yet, what I'm hearing from people that we consult with, our clients, advisory boards that we participate in, today's challenge isn't finding more leads. Literally and figuratively, your desk is full. It has huge piles. What we really need to be focusing on is how can I prioritize my resources to deliver the biggest impact? And that biggest impact being either the largest recovery that we could possibly get to bring money back into the system to pay for appropriate care. It could be coordinating with law enforcement to take something down, to show everyone out there that might be considering involving your claim spend in a fraudulent activity, that you are watching that door, that people aren't going to be able to get past it. Or put it another way, the opposite. Making sure that someone in your organization doesn't come knocking on your door and saying, hey, look at this scheme that just occurred. What's our exposure? And why didn't we find it before it was announced? These are the challenges that we're looking to address as we continue to show you a blueprint that could be deployed to help you uncover these schemes and the credibility to go ahead and be the one that presents to the world that this was found and uncovered, not that it occurred to you. Mary, time for our next poll, I believe.
Yes, polling question number 2. So what is your organization's top challenge? Difficulty finding links among and between social groups? The inability to uncover larger and hidden schemes between patients, providers, and businesses? Triaging cases for your SIU teams? Identifying and preventing fake individuals from enrolling? I'll give everyone 10-15 minutes. Make your selection, please, and hit the submit button. And we'll move on to the results. Most inability to uncover larger and hidden schemes between patients, providers, and businesses. Rich and Rick?
Thanks, Mary. And that's a perfect segue to our next slide. Can you assess social and behavioral challenges? One of the biggest problems we see with our clients, and when they ask us to help come in and assess what their program is and up to these days, is whether or not they could answer these key questions. Again, it comes down to the big three about identities. Who is this person? What do we know about them? What risks do they carry? And who are they associated with? For instance, are you able to determine that your providers share an address with a member or businesses? Another key one, are there silent partners in this business of interest? That's a key fraud scheme where we find out that there is a business owner and then there's a silent partner. And the silent partner has a very suspicious background. How can you identify that while you're going ahead and determining which cases you should prioritize? And what relationships exist between your suspicious providers and known suspected criminals? I'm going to turn this over to Rick now, who'll start taking us through some of the ways that we could help uncover and prepare a new blueprint to address fraud, waste, and abuse.
Thank you, Rich. As we've been discussing identities and the challenges tied to mitigating identity-driven fraud, we'd like to take a moment and discuss an example that really touches on an issue that's plaguing all of the nation. It's a topic of abuse, the opioid crisis, and it's really an example driven by situations of identity abuse. In this example that you see up on the screen, which is ripped from the headlines actually from the Boston Globe, you'll see that there's actually a situation, a scheme, so to speak, that's been perpetrated where individuals that were seeking help for their opioid abuse were taken advantage of. In this scheme, brokers enlisted patients for sober home treatments, flying members down to Florida for fake or legitimate services. Once their interaction at the sober home had occurred, they repurposed their identity data and signed them up for health plans in other states like Kansas, Missouri, Georgia, even going so far as to pay the premiums for their coverage. Once enrolled, the sober homes were then able to bill multiple health plans or insurers for large volumes of services, and without the proper checks in place, they received payments for services that greatly exceed the initial costs of enrolling these members. Long term, this also put the clients at risk, both by not providing the members the services they clearly need, as well as creating a mess of their identity data, increasing their future likelihood for abuse down the road. So I mention this as this scheme actually plays in nicely with a process that we'd like to take you through over the next few minutes. And it's a three-step process, really starting with the concept of prevention. This concept starts with a story, and we're going to talk about our member, John. So meet John. This is John Doe. He's your average member that comes in as he interacts with your plan, with providers that service your plan. And there's a few questions that you can ask him at every point of interaction. The first piece of this identity process is to discover if the data that he's submitted is real, both at enrollment as well as at the point of interaction or the point of service. You can ask, are you John Doe, and does John Doe really exist? You can verify that each of the elements that he's representing with belong to a single entity, and that he does indeed own that identity long term. Assessment of whether or not there's any risk tied to him helps us prompt the question of, if you are John Doe, can you prove to us that you are upstanding, that you are acting with good intent? And plans can receive notifications when high-risk behavior is either exhibited or identified tied to this member over time. So we see across the different industries, there's a wealth of different tools that are available to help with this discover, verify, and assess process. These are what we'd like to talk about as really an enterprise risk management approach. Most of these tools, and you interact with them in your day-to-day, are designed to be secure, convenient, and low cost for different industry partners that are seeking to have a certain level of identity confidence and identity assurance as they interact with individuals. Now, some of these which you use more frequently are knowledge-based authentication assessments, and these are really something you know. They ask questions like, which car did you drive in 2005? What color was it? Which address have you shared with this specific individual that is in your public record or background of history? There are often one-time tokens that can come, possession-based, and these are things that really represent something you have. More and more, we're used to receiving that text message on our cell phone as we're interacting with some sort of secure system. Sometimes we'll receive a one-time email, and many of us nowadays are actually starting to see even document capture processes. I know it's become popular among the younger group. As you go out to the club and things like that, that actually driver's licenses are being captured and verified to not only prove age, but show that you are indeed represented appropriately. Biometrics are something we're starting to see more and more as we interact with the industry, and these represent things that you are. If many of you have heard about MasterCard, they released earlier this past year an opportunity to actually confirm a transaction via a selfie. A lot of you will interact with voice recognition systems. Even as you interact with your iPhones most of the time, you'll actually open it with a Touch ID or even the new iris technology that verifies you're looking at the device before it grants you access. These things that you are all ways that you can have a certain level of confidence of these identities as they're interacting, specifically looking in context, and that's context of how they behave. Are these individuals coming in from a device that you see on a regular basis, or suddenly has a new device ID been recognized? Are they coming from an IP address within your state's boundaries or within the nation's boundaries, or do they seem to be coming from overseas? Have we suddenly seen this member multiple times in a very short period? Do they have a high amount of velocity for interactions with us? These types of questions really help drive us to the assessment piece that we're all looking for, and that's the analytics. That's the question of how do you differ from your peers? Are you risky? And if you are risky, what is it that we as an organization or a plan can do as we interact with you? So prevention, as we've talked about at this point, is really focused more at the member, and that's our member John down in the bottom left. But I'd like to also encourage you to think about this verification process as providing very much to your providers as well. All of these provider elements can be also captured not only during enrollment, but also portal access, the point where scripts are written. All of these same questions on identity. Are they real? Do they own it? Are they risky? These things can trigger you to either provide greater scrutiny to them as you interact with them or as they bill you for services. Now, there's another step that is often used outside of identity verification, and this is really the leverage of using known watch lists or identified risky individuals, suspicious individuals, or bad actors. These are still part of the verification process. They look at situations for known fraud, identity discrepancies. They look for negative or derogatory info that might be in their behavior. And these things apply to both our member and to our provider, looking at situations of deceased, bankruptcy, criminal records, as well as judgments, exclusion lists, verifying that the elements that they're providing to you at every step during the interaction is indeed accurate, up to snuff, and that it's not someone else that's using their identity moving forward. This really drives us down to 4 points that allow you to answer some key questions on both our providers and our members. Are they real identities? Is this person that is representing themselves the actual owner? Are they suspicious or risky? Do they have any type of behavior associated to them that makes them more risky? And are they a known bad actor? Has someone else identified them already as perpetrating or participating in some sort of scheme or negative instance? Rich, did you want to add anything to the prevention cycle?
Yeah, thanks, Rick. A few best practices that we're seeing in the industry already in the involvement of some of these lists that you had shown on the previous slide. For instance, we have a lot of clients who are starting to utilize information about from deceased records, looking for physicians or members that have claims coming in from them that have been deceased for more than 180 days. So the likelihood of any legitimate claim coming through past the person's deceased date is pretty much no longer valid. Another way of utilizing something prepayment and sent to manual review is the sanctions information. So when you see a particular physician have a claim come on in and they are known to be excluded from Medicaid or Medicare, that should immediately send up a red flag and send that over to manual alerts. Also being utilized retrospectively, we see judgments and liens and bankruptcies. They're a fantastic way to go ahead and analyze changing in provider billing behavior. And if you could spot that there's a correlation between an incident, since there's a lien from the IRS or a bankruptcy that occurred at the time of their change in behavior, It's a great way to start to uncover that there was actually criminal intent. And then a growing one, especially with the advent of the exchanges that have occurred, is fictitious or false identities being enrolled. And so being able to go ahead and understand when that personal identity information doesn't belong to just one person. The name might be legitimate, but the address, the phone, the social security number belong to other people, or maybe that social security number is being utilized by 5 different people. Again, a red flag which would allow you to prioritize that for investigative purposes. Thanks, Rick.
The next phase that we're going to move on to as part of our 3-stage fraud, waste, and abuse process is detection. And detection really allows you to see another layer of interaction that you can't get at that preventative layer. And that's where you have the handshake occur between Dr. Bob and John Doe. It's when John sees Dr. Bob for some type of service, some type of new point of need, that we have an opportunity to detect fraud, waste, and abuse. And there's a wealth of tools that are actually in place to do this already. There's also some that are just starting to emerge in the marketplace, so we're going to speak about those over the next couple minutes. As we look to detection, the first piece that I'd like to draw all of your attention to is the claims data mining solutions that are already leveraged heavily within our marketplace. These are really driven by business rules. And under these conditions, we can investigate situations of fraud further using hundreds of rules on specific conditions, using rules-based systems, which are the primary fraud, waste, and abuse detection models, especially among our SIU units, in order to really identify the bad apples that are interacting with your plan. So these are driven by the need to place roadblocks in place as you interact with a provider or a member based on your past experience. They detect they detect fraud by applying thousands of rules that look for situations of things that should occur together but don't. Situations where you have peer-to-peer comparisons that pop up one specific provider or a group of providers as worst offenders. Those that are high code users and those that might be tied to suspicious activity that's really driven by your past experience of them. Rich, would you like to add some context to this as well?
Yeah, Rick, that bottom gray area, look for missing things that should occur together, is one of my favorite. And I think one of the most frequent schemes that we all talk about these days is that legendary ambulance ride to nowhere. And that particular one, what you're looking for is obviously an ambulance charge, and you're looking across multiple different claim intake sources and seeing whether or not there was a hospital or a clinic stay at the same day. If you don't, if one thing occurs without the other, that obviously leads to a lead that should be pursued. Conversely, on the opposite side, sometimes it's things that we shouldn't see that do come together. We're seeing an uptick in physician-owned by hospitals, or physician groups owned by hospitals. And when you get the bill, the physician and the hospital are all on the same claim, inclusive together, almost as a bundle. But later on, a week or two later, the hospital sends you a separate charge, again for their portion. These two things shouldn't occur together, and the ability to take a look at these separate claims coming in and see that they occurred on the same day of service alerts you to the problem that you shouldn't have to be paying both of these on the same date. And again, now I should go and see whether or not this is a scheme that's been repetitively occurring throughout my claim spend. Now back to, if you could take us back to those bad apples, Rick, I was enjoying that conversation.
Thank you, Rich. So as Rich has mentioned, the ability to inform investigations really through this comprehensive view of providers, members, and your claims data gives you an opportunity to look at those who habitually break really your claims rules and demonstrate risky behavior, aggregating and researching across your claims in a single view. But we do see some challenges tied to these types of rules-based systems, and that's really that they're subject to situations of high false positives. Sometimes there's legitimate reasons that someone may trip a rule, and ultimately obsolescence occurs. They become obsolete because fraudsters change their schemes and adapt, and new rules need to be updated and old rules need to be moved out over time. So there's another tool that's gone in place in order to help fuel these claims data mining systems, and that's the use of predictive models. This is the use of using large volumes of data to not just identify those bad apples, but specifically to start looking at the individuals, the apples that are starting to turn bad. This uses segmented scores, statistical models to reveal suspects, reveal patterns of behaviors that increase risk, and ultimately bubble up these patterns into known or emerging bad actors. In this situation, there may be segments where a predictive model would be different from what you do today in your claims data mining tools by actually going through and creating patterns and matching algorithms that look for fraudulent claims or individuals associated with those claims. And those thresholds can be reviewed and refined and become more and more predictive over time. Now, we've talked a little bit about the methods that are currently in place in order to identify critical components of fraud, waste, and abuse. But there's one aspect that we haven't hit on to date, and that's really, who is this guy? Who is this individual that helped John into Dr. Bob's office? And how does he play with the interactions between those two folks? This critical component is relationships. That member, being Jack, identified here, turns out he's the roommate of Dr. Bob. It also turns out that he is the sibling of John Doe. And while this is information that you might know if you knew those individuals in their personal lives, it's not something that's readily apparent just looking at claims data. This takes a step beyond the need for just investigating within claims, but instead looking at outside sources for providers, for members, for businesses, as well as the relationships that exist through a number of different means, both in their professional and personal capacities. And this really brings us to a larger question. What is a social group? What is critical about these interactions? And that's oftentimes folks that share a lot of attributes in common act as one. They work together with really a sense of unity. And this sense of unity gives you the opportunity to predict behaviors and really glean insights through the interaction of these folks together. Spouses are an easy example of this. If you and your wife are interacting at a provider entity or a business, chances are you're sharing a lot of the same financial motivations, addresses, same networks of associates and relatives. Sometimes it'll be social or religious organizations that you participate with. There's also other social group aspects that can bubble up risk to you as you're evaluating a provider or a member. And that is specifically that tied to their history, who they've been roommates with, who they've been in business with, what relationships they have, what ownerships they share in common. These become critical because as you evaluate one individual, those other individuals, if they're interacting with you that are in their social network, are really a point of risk. So this concept of taking a view on the social groups that are tied to your provider, to your member, is the concept of mapping relationships. And mapping relationships gives you the opportunity to leverage not just claims data, but again, outside data sources, non-healthcare assets, in order to influence your decision-making. Now, mapping any kind of relationship is very challenging. It's challenging not only due to the complex nature of the identities you're interacting with, you have to resolve them, as well as all of the places they've been found, but they also have the challenge of bubbling up individuals either through a targeted approach or through needing to look at clusters. Many of you, as Rich mentioned, have stacks on your desk. It's no longer a matter of I need more leads. It's I need to know which leads are best. Who's going to give me the biggest bang for my buck as I'm investigating them? Who, if I take them down, or which group, if I take them down as they're perpetrating a scheme, are going to save my plan and ultimately save my members a lot of heartache. So this really requires the use of outside data sets. It requires a wealth of robust data assets in order to look at not only the bad actors that are known or suspected, but to bubble up the clusters of people, entities, claims codes, or locations that really are the most suspicious, that really are tied together by the same close network or social group that are interacting with your plan. Rich, did you want to add to that as well?
Thanks, Rick. When I think of this slide and I think about relationship mapping, the thing that pops right into my brain is drug diversion and how this could help us, right? We all tend to utilize analytics, maybe outlier detection, to see if someone's a far outlier compared to their specialty group in the prescription of an opioid. And that gives us initial information to start reviewing whether a particular prescriber is probably overzealous or involved in a scheme. But what if I'm involved in what if I'm that doctor prescribing and I'm involved in a particularly sophisticated screen? What if the people I'm involved with understand that if I'm a significant outlier, that I'm going to be reviewed, and they don't want to kill the goose that laid the golden egg? So I'm probably fitting around one standard deviation from the norm. And that's because they have other doctors involved on the scheme. They've recruited patients that they are going to utilize their IDs for services never rendered, and then they're going to use that to get the prescriptions written, filled, and sold on the black market. Claims analytics alone would not find this. However, if we take a look and marry this and do the linking that shows relationship mapping, we can determine that that doctor, who only is one standard deviation from the norm, triggered an alert. And that alert is that there are known criminals in his tight social groups that Rick just explained. And two of those criminals live at 123 Main Street. It just so happens that 123 Main Street, an apartment building, is where 90% of my prescriptions for opioids have been written. People live there. Those are the members that I've written them for. That's the power of relationship mapping and being able to marry identity data with your claims data to uncover those social groups. Thanks, Rick.
Thanks, Rich. So really, what all of this detection discussion that we've had so far is driving towards is the assessment of whether or not this member, this provider, is a good individual, a good actor, or a bad actor. In many cases, this is more than just a pure identification of fraud. Sometimes it's focused on the waste or abuse that comes from individuals that are scheming the system in different ways or potentially upcoding with limited knowledge. Now, provider education, not just for physicians, but for situations like sober homes that are interacting with you, sometimes DME clinics, understanding if folks are involved in patient sharing or maybe they're part of a scheme that's driven by addiction. These give you opportunities to improve your members' health as you surface these good or bad actors. And as you do that, you have the opportunity for expulsion, to referral to law enforcement, or to make the determination that the intelligence you're gathering now can be leveraged during an investigation down the road, and potentially not just for you, but for other organizations. So with that, I'd like to kick us off into the third part of our three-stage process, and this is really collaboration. Collaboration is where we view there being a significant uplift and insight that you can gain as an organization through sharing and collecting data that is imperative to your investigation. So I'd like to actually start this section by giving a little bit of a parable. I'm going to use the analogy of stone soup. For those of you that aren't aware, this comes from 17th century France, and really how it starts is we have a traveler that comes into a village. He walks up into the first person he sees, he asks, "Excuse me, can I borrow your soup pot? I'd like to make stone soup." He takes this pot, which was given, and he takes it to the center of town, builds a fire, fills the pot with water, stokes it, and pulls a stone out of his pocket and places it in the center. He places nothing else in the pot, but as the fire roars, the water begins to boil and steam starts to come off. And of course, during this whole process, all of the individuals that have been in the village are watching him. They're gaining suspicion as to what he's doing, and they're starting to ask questions. And as he sits there over the pot, he actually starts to stir it, lifts some of the steam that's coming off, and says, "You know what would be great? If this stone soup could have a carrot." Somebody says, "I have a carrot," and they go home and they bring it to the table. And slowly, one by one, the villagers bring different ingredients, carrots, beef, vegetables to the table that get introduced to the stew and slowly merge together over time. When the stew has really come to a full boil, it's very robust, the salt has been added, he takes the stew and he doles it out into cups to the different individuals that have gathered and contributed, and has a little for himself as well. Now, this analogy, while simplistic, actually is the basis of our story for collaboration. And that is, each of you have these different ingredients. You have known bad actors, known watch lists, known fraudsters, known schemes that you've investigated, known facilities that have been tied to risk, known providers that have been associated with, known identities that you have seen breached again and again as they interact with you, or one of the folks that interacts with your pair organization. In the same way that all of these insights give you the opportunity to learn more about the individuals that you're interacting with, some of these insights could be bubbled up and shared with others. This is not a new concept in the industry. It is something that we've seen across the board. All of you actually, as part of your NHCA membership, see and have use of a solution like this with Cirrus. But I'd like to give some examples of where we've seen similar situations of collaboration work outside of the healthcare space. Some of these are clearinghouse solutions or contributory networks like Clue. It's a comprehensive loss underwriting exchange. This is a property and casualty insurance that every time you or anyone else in the United States applies for insurance, you are vetted against this database for risk. When I bought a home, I got a notification that I was being checked against Clue. Others are things like the LexisNexis Fraud Defense Network. This is a cross-industry collaboration event where we have folks that are bringing known bad actors to inform the risk of folks in insurance, in commercial space, in government, as we start to see those bad actors across the board. Because the reality of it is a bad actor is a bad actor no matter where we first see them. Some of these are situations like NAC, the National Accuracy Clearinghouse, that leverages data to identify dual participation across public assistance programs, or FDLE, the Florida Department of Law Enforcement, that contains assets on known criminals, criminal activities, and locations to help support and drive the state's ability to combat crime. Really, bringing data together across the board gives each of the collaborators an opportunity to benefit from one another's experience. And as we go back to our example about John and Dr. Bob, your plan has some of this information to date. You have that view of that interaction that occurred between Dr. Bob and your member John, as well as potentially Jack, who brought him in the door. In many cases, you'll have Dr. Bob as he enrolled in your network. You'll have your beneficiaries or member John as he has applied and received health insurance through you. And similarly, other payers have views of these members as they've interacted with them currently or historically. In some cases, maybe it was John Smith that actually was, or John Doe that actually was the perpetrator of a scheme, or maybe it was Dr. Bob, or maybe someone else actually has a greater view into the network or the social group of folks that are associated with any one of those parties. I like to think of this as really giving you an opportunity to think of yourself as currently looking through a microscope or looking through a looking glass. There's more that can be seen when that glass gets removed or when multiple glasses are put together as you are all looking really at the same individuals over time. So collaboration allows you to identify fraud earlier and faster. It expedites investigation and coordinations not only between your members within your plan, but also between plans. It can decrease the amount of time and allow you to make higher confidence decisions as you interact with folks, eventually moving from that pay and chase approach to potentially more prevention and detection processes. The ability to use this data to determine who is risky and who's not, even if it's at a metadata level as a flag or an indicator, is an opportunity for your fraud investigations to really expand well beyond their current scope. So with that, I'd like to prompt you to think about some of the questions that collaboration can empower you to ask. Otherwise, you wouldn't have been able to see these A, before, or B, only within a limited view of the entities you currently interact with. Some of these are, does another payer find this member or provider risky? Is this member potentially covered by another plan? Has another plan found this person perpetrating a scheme? And really, should I pay this claim in the first place? These types of questions are really driving the need for collaboration across the board, as many of us have encountered the need to identify coverage outside of my existing plan, out of network status for a provider within another plan, and even situations tied back to our opioid prices. Maybe is this member doctor shopping? Have they already filled and recently filled a script for an opioid prescription? Rich, did you want to add some context?
Yeah, thanks, Rick. You know, is this out-of-network provider in network another plan? That is something that actually was brought up to my attention one time, because it was the first time I saw this provider, and they didn't want to set up a exhaustive manual review every time this occurred, but they were hoping for is a real flag saying, hey, we don't know this provider, but if he's been credentialed by somebody else, that that allows us to have a little bit more credibility that for the amount of times that we're going to see this person have to have a bill for them, we're going to go ahead and let that pay. But if they haven't been, if they're not in network with anyone, we might want to do a lot more due diligence before we continue to allow payments on claims coming in for them. But the story I really want to talk is about something that was a project we did for several payers. They all collaborated their data from a specific region, and we ran it past the fraud defense network you referred to. And again, that fraud defense network is a contributory database across multiple industries that's basically set up for the premise that if you commit fraud in one industry, you're likely to commit it in multiple others. We aggregated their data and we took a look, and what we found was there was a facility owned by a doctor that was being investigated by multiple industries, not just healthcare. The combined amount of claims from the participating plans involved in this showed that they were billing for more hours than there were in a day. Now, in this particular case, the sister was the doctor, but the brother was the silent partner. And the brother had a history of criminal records. And in fact, the property and casualty insurance had investigated them and was pursuing something in regards to staged automobile accidents. The combination of aggregating all that claims data to get a more comprehensive view of them and merging that with identity data, as well as data from multiple industries, told a more complete and comprehensive picture that allowed these participating plans to understand the scheme that was going on and to take action moving forward. That's the power, I think, of collaboration and the questions that you want to start to think, how will I address these moving forward? Thanks, Rick.
Broadening this view to a collaborative approach really gives you an opportunity to use the intelligence that other payers and other industries have gained in order to give you greater accuracy and a broader view as you conduct your fraud investigation. All of the tools thus far that we've talked about are still pertinent, and each of the stages, prevention and detection, can actually leverage the intelligence gained through collaboration, both by looking internally within specific payer networks, externally at really all of the known or suspected information tied to fraud, waste, and abuse activities, and then even for new and emerging bad actors or schemes. As Rich mentioned, we often find that there's a lot of correlations between bad actors that we see across industry. Healthcare and tax fraud, healthcare and government are great examples where a bad actor found in one is often involved in another. And this actually drives back to our initial enterprise risk management approach, adding another tile on the right-hand side. And this is that collaboration-based analytics that can fuel prevention. And this is telling you what others know, not just the information that you have, but flags or risk indicators or even direct intelligence on a specific interaction that has occurred with that member, with that provider over time. This also fuels back to our detection process. And as we talked earlier about the scheme of individuals that were having their identities really transgressed against by the sober home scheme mentioned, we actually could have stopped the scheme if these types of insights had been bubbled up and identified by any number of payers early in the process. Fraud insights could be shared on the brokers, the facilities, the owners, the members or the patients themselves that were involved in enrolling in these facilities or having their identities really stolen and transgressed over time. It could be that a specific social group was at risk or a specific social group was perpetrating these activities. Common services were clearly billed. We had situations where if we knew other plan participation, you quickly would have been able to cut off any step from this fraud, waste, and abuse scheme from occurring. And it really could have benefited all those involved through the sheer efforts of just sharing some information. So how do I make this information useful, and what are really the challenges that come with collaboration? I'll note that collaboration is not a simple task. It does have a number of challenges and a number of hurdles that different organizations will have to overcome as they're embarking on this type of effort. Now, there's some situations that I'd like to take some time and speak to, and we're going to cover some of these in greater detail. Legislation and regulations are one, technical complexities of establishing the system and maintaining the system, the privacy and security of these systems, and really the data sharing agreements that need to be put in place to fuel this process in the first place. The first we're going to talk about are the legal and regulatory challenges that organizations face. And this really comes down to a concept of who owns the data what are the regulations that are tied to data sharing, and what are the regulations tied to the specific data usage. The reality of it is if you want to collaborate, you'll have to make the best possible case to do so. You need to work closely with policymakers, regulators, lawmakers, and other plans to implement the proper data sharing agreements and use cases. Fortunately, there are a number of data sharing handbooks and best practices that are in place, and there's a wealth of folks that have industry expertise working with contributory. You can acquire this knowledge and then have the rules of the road of how you need to drive it. Can everyone come in and conduct a search for your system? No, of course not. But certain individuals with certain permissible purposes and certain uses can. Clear data sharing agreements, things like MOAs or MOUs, memorandums of agreement or understanding, are an essential component that you want to clearly define so that you can enforce and hold stakeholders accountable and give clear confidence as to what's being done with the data that's being shared. You need to be able to answer these questions to every player's satisfaction in order to be able to get this type of initiative off the ground. But once you do, you can easily go in and limit what can be seen by whom, what types of users are able to access, and for what intended purpose. The next piece we'd like to talk about are the privacy challenges. This is an area that requires ongoing focus because we have a goal to minimize PII or PHI, the information that gets shared and that you really need in order to make a match. Match confidence, identifying this individual actually is this other person, resolving those identities, they require some key input criteria, but with these match confidence levels, you can actually decide how you're going to interact with the data that you're provided with. It might be that you need a name, an address, a partial SSN in order to do this, but it's critical to only contribute what's absolutely necessary. And then once the PII is contributed, what's done with it? Is it resolved to a unique identifier, and is that the information that's stored moving forward? Privacy groups look very closely at these types of systems, so it's important that you provide a clear explanation as to what is being shared so that the media, privacy groups, and oversight groups have a clear understanding of what's going on and don't jump to conclusions. Some parties will likely have concerns about how it's received. You don't want a system to be perceived as a Skynet or Big Brother type system. Those have poor reception. But a system that protects people's identities by reducing the likelihood of fraud is much more likely to be welcomed or accepted as part of the ongoing operations for any fraud, waste, and abuse activity. The last piece I'd like to take a moment and touch on is security. And this is really driven by the concerns of how big a system will grow, how do you securely contribute data, what are the risks of contributory data storage. Currently, we know that you all are interacting with a number of entities. You're faced with a number of process challenges, technical challenges, investigative challenges, and pulling data together can actually give you an opportunity to put more safeguards in place. I know that many payers have limited resources available for the data security component and the compliance component, and really effectively transferring this information sometimes outside of your walls to an entity that is required and really bringing to date the latest technologies gives you an opportunity to put extra safeguards in place. I'd like to use the example of a fort and walls. In many cases, we are in the process as organizations of trying to set up barriers to some sort of preventative mechanism for fraudsters to not be able to transgress. These are often walls that are based on our best practice and knowledge and understanding of the information to date and the risk to date. These fraudsters are smart. They're actively trying to dig and get through the walls. So adding additional layers and maintaining those layers, adding ongoing complexity and diversity to it over time is critical. And that really goes back to the enterprise risk management approach we talked about before. We may be at a point where we're focused on knowledge-based questions now, but in the future, those collaboration-based questions may make all the difference. The last piece of this process is really the need to balance data sharing and information security. This is an area, as we all know, is a challenge. HIPAA rears its head in all of our interactions. PII and PHI and the concerns about sharing it are intense. But with that said, HIPAA shouldn't cause you to bury your head in the sand. There's effective ways to put the proper administrative, physical, and technical safeguards in place so that we can effectively share data. So with that said, effective healthcare collaboration requires sharing details on providers and members and the interactions that occur between them. But it also requires a robust contributory infrastructure, one not just technologically, as mentioned, but one that has sufficient legal, regulatory, and privacy and security measures that takes into place all of the things that we've talked about today. To accomplish these needs, we need effective permission matrices, data sharing agreements, and pre-negotiated and agreed to use cases by all stakeholders that are involved in this type of initiative. Now, since these are complex, I encourage you to be patient, take time, because innovation takes time. Taking this step as an organization, as an approach, as an industry will require ongoing collaboration and really everyone weighing in. That said, I'd like to turn it over to Mary. I believe we have one final polling question.
Yep, thanks, Rick. Our final polling question: which area has the largest potential for growth within your organization out of the three we've discussed: prevention, detection, or collaboration? Give everyone a few minutes to answer. Well, a few seconds, I should say. I really have a few minutes left. And moving on to our results. And collaboration is the winner. Rich and Rick?
All right, thank you. So at this point, we'd like to reframe some of the questions that we talked about earlier that require collaboration. Going back to our initial example, the nation is facing an epidemic of epic proportions, and really the intelligence that is gained through collaboration can help us gain insights on the ways we could combat this problem. So I'd like to draw your attention to the right-hand side of these questions, and that's really those that are focused on the opioid epidemic and situations that could indicate and stop potential opioid abuse. With those in mind, I'd like to take us back to our story of Dr. Bob, John, and Jack, and actually enter in one final player, Mike's Pharmacy. The location that we find John and many of other Dr. Bob's patients are frequenting in order to have their scripts filled. What's odd about Mike's Pharmacy is it's not close to John, it's not close to Dr. Bob. It actually seems to be quite a distance from any of the parties that are receiving scripts from Dr. Bob. Rich?
Thanks, Rick. I know we're running out of time. What we've done with some antidotes working on drug diversion and doctor shopping is we found instances where members were driving over 150 miles to get a prescription filled. And it was never at your large national chain. It was at your Mike's Pharmacy. So that is one herring to take a look at. The other thing to notice is that another project we worked on, we were provided a lot of information about people who attended ER and emergency rooms, and what we found is an instance of 83 times a person had presented themselves to the emergency room complaining of lower back pain. This was always diagnosed as a sciatica or kidney stones, and they were given a temporary prescription for narcotics to hold them over until they could go see their primary care physician. The health plan suspected something and sent us this information. What we found and what they reported to us was of the 83 times, 79 times that person received a prescription for narcotics. But of those 83, only one time was that person who presented themselves with the problem actually a real person. All the other times, this person had gone to the ER and changed a digit or two in their Social Security number. They had used first name and last name combinations from relatives and old roommates, and then combined that and former addresses that used to live at to create a wealth of fictitious or synthetic identities. Now, that particular person was pursued in legal recourse and probably served some time, but I believe by now they're probably out. Wouldn't it be useful to know all those aliases? We all hope that person is no longer an addict, that they've solved their problem, and they moved on with their life. But knowing those false identities, knowing those false addresses, could be a high alert anytime you see that to take action right away, both from a payment perspective as well as a scheme perspective. Back to you, Rick.
And that gives us insights into our story of John, Dr. Bob, and really Mike's Pharmacy. Each of these insights allows you to ask further questions about these entities. Situations like, is John visiting multiple pharmacies? Does he have health insurance coverage with another plan? Is Dr. Bob a high-risk provider? Has he been removed from another network? Is he an outlier for high-dose prescriptions when aggregated across payers? And then specific to Mike's Pharmacy, how has Mike's Pharmacy been identified by others? Does it have criminal background tied to the owners? Are there patients that are driving outside of the norm to visit it for other plans as well? These types of questions, this type of collaboration can really only occur when parties bring down the barriers to share information. And this is really what takes us full circle. We've touched on prevention, the risks that originate from identity-driven fraud, and the use of watch lists to find known bad actors. We've touched on detection, the use of claims and data mining tools, predictive models, and the intelligence that really comes from effectively mapping relationships to look at high-risk entities, locations, and social groups. And finally, we've talked about collaboration, which is really the ability to share your collective findings and insights in order to refuel the prevention and detection processes. We'd like to thank you for your time this afternoon and the opportunity to lead you on this journey, and we hope we've given you a new view into the fraud, waste, and abuse system and ways you can combat it as your agency or organization interacts with any of the individuals that are high risk. Mary?
Thank you, Rich and Rick. Unfortunately, we have reached the top of the hour, and we will not have time to take questions. Well, if you want to hang around for a couple of minutes, we can try to take a couple of them. Let's see. First question. Have you been seeing or working on the issue of claims for U.S. members from overseas providers submitted by billing entities in the U.S.?
Rich, would you like to take that one?
So, Mary, that was, are we working on, can you repeat that? I want to make sure I got all the different parts together. So,
yes, have you been seeing or working on the issue of claims for U.S. members from overseas providers submitted by billing entities in the U.S.?
Okay, got it. No, not today. The reason being is that the U.S. members we keep track of, and LexisNexis is part of an overall company called the Relics Group, which is actually based out of the UK. And we do have provided data assets and information and intelligence on identities throughout the entire world. However, it is a country-by-country basis by which we have it, and so it isn't as thorough in many countries as it is in the United States or some of the, some other countries throughout the world. So I wouldn't be able to say we address that all together, and our focus right now is there's more than enough opportunity with U.S. members, U.S. companies, and U.S. providers, but that is something that's on the roadmap for us to go ahead and integrate. I wouldn't expect that for the next couple of years.
We have had some collaborative efforts starting to occur with some of the different geographies outside of the U.S. However, I'd say that those are still in early stages, to add to Rich's commentary. Some of this is in the Latin American countries as well as some over in the Eurasian area.
I will say that if a doctor is practicing in the United States, even if they've gotten their education from somewhere else, we have very good track of them right now in our systems today. But the facilities and providers that are outside, we've just begun the collaboration with our company and units throughout the rest of the country to try and commingle data.
Great. Thank you, Rick and Rich. We'll take one more question. We're at 4 minutes after the hour. Have you looked at mail order opioids?
So that's an interesting question. We are actively working with a few different development partners on a concept of drug socialization, looking for high-risk providers, patients, and prescribers. Mail order pharmacies and mail order prescriptions being filled would be a component that is under evaluation as part of that project. So if that is something that your plan is interested in, we would welcome ongoing discussion and collaboration with you on that solutions development.
Thanks, Rick. Let's try to fit in one more. And any questions that we don't get to, we are capturing them all, and we will answer them via email. We'll fit in one more. How can you prevent providers kickback using your methodologies?
Rick, you want me to tackle that one, or you want to jump in?
Why don't you go ahead, Rich?
All right. So, that's a great question. Obviously, there's not going to be an electronic record we could read on in of someone's bookmaking on what bribes they paid or kickbacks. And if there ever is the case, wow, would that be foolish on their behalf? What we're really doing here is they can look at your claims to spend, and we're looking at all the social groups that are associated with it. And what we think has the most bang for the buck right now is looking at those social groups and finding the unknown relationships and known criminal behavior already associated with that. Now, with the identity assets that LexisNexis, it doesn't have to be us, but the identity assets that we have in place right now, we have federal, state, county, local, and municipal records around criminal information. And what you'll see is that about 10% of America actually has some type of criminal background, but overwhelming, because that's a large number, right? It's DUI, it's jaywalking, it's interrupting animal migratory control, it's hunting without a license or a license that's current, things like that. It's significant. It's less than 1% what we're really talking about: domestic battery, assault, attempted murder, things like that, which would cause you, and obviously fraud. And we talked about the Fraud Defense Network being able to indicate whether someone was involved in a credit card fraud scheme before, or a mortgage fraud, so on and so forth. So it's that information and drawing the relationships there where we believe right now we could deliver the most bang for the buck. And that hopefully throughout the course of your investigation we'll be able to verify that, hey, there's social connections here which are very suspicious, and as a result of your investigation you find out that there was that kickback involved.
Yes, those undisclosed entities, and really even the crimes that those undisclosed entities' relations are actually perpetrating or have perpetrated over time, can give you a much greater insight into the provider you're interacting with. It may not be that Dr. Bob was the bad actor, but maybe Dr. Bob's wife's brother is the individual that has perpetrated a scheme and has a similar specialty to Dr. Bob, and it's his relation to him and his interaction with him that makes Dr. Bob a higher risk potential individual to perpetrate that scheme as he interacts with your organization. That view of a provider, their professional network, their personal network, and how their data is changing over time gives you a critical way to view them and evaluate any risks that might be emerging, not only from that provider directly, but from influences within their network.
And I'll add to that, Rick. We did a really good example, and there was one provider who came out squeaky clean in of himself if you look at the professional background. But if you look at their personal background, one of their children had been kicked off Medicaid and Medicare on the exclusion list. So that all of a sudden, even though maybe you didn't see anything in your claim analytics, and when you re-credentialed them, there was nothing there that caused suspicion, knowing that in that tight social group, in this case their child, has been kicked out of Medicaid and Medicare and excluded from being able to provide or participate in those services, now it gives you a different idea of how you want to examine and look at that original provider's their claim spend and keeping a closer eye on them.
Great, thank you. Well, I see that we actually do still have quite a few folks hanging on with us here, so let's go with one more question. Have you been involved in any contributory project? And if so, can you share which project and some of your key lessons learned?
Sure. So, Chris, I'm happy to
go ahead, Rick.
That one if you'd like. I've been involved in a contributory project that's been occurring on the government side. That project is the National Accuracy Clearinghouse. It's really a clearinghouse that's been established to identify potential instances of dual participation across public assistance programs. Some of the lessons learned that really come from that is that it requires great collaboration and partnership between any of the stakeholders and the ability to stick with a project over time in order to really make a difference. This is a consortium of states that came together and worked to share information, break down data sharing barriers, and collaborate with insights that allow them to influence real-time preventative decision-making as well as their investigation efforts. So I'd like to note that that partnership that exists between the different stakeholders, holding one another accountable, working through the process really as a collaborative unit, is a critical takeaway from a project like this, because it has potential, unlimited potential to actually influence the way you do business and make intelligent decisions. But it requires the alignment of all the stakeholders and clear use cases for how you interact with that information that you receive from them in your day-to-day processes.
Thanks, Rick. Well, we're right at 10 after the hour, so we'll go ahead and end the webcast at this time. Thank you, everyone, for joining us. We appreciate your time. We will be sending out a follow-up communication that will include a link to download the slide deck and the webinar recording, and then we will also address any remaining questions via email. Again, thank you all very much for your time.